Hello and welcome. This is Deepak Mishra and I welcome you all to my YouTube channel. Today in this video I am going to talk about aggression against doctors. This is a very burning topic which everybody wants to know that in India we know how the situation is. We get those information every day, either in worst case scenario through practical experience, through personal experience, or through newspapers, YouTube videos, news channels. So people go on strike every month, I would say, in different parts of the country. So we know how it is, and then we want to know, my viewers who watch these videos are aspirants of post-graduation or further work in Germany. So they would want to know, they always want to know that how is the situation in Germany. So in this video I'm going to compare and contrast the situation between two countries, and I'm also going to give some factors which I think, is my personal opinion, that what I think is the reason why what are the factors contributing to the situation in Germany. So first of all, I would say on the very blanket statement that the situation in Germany is not as bad as in India. First of all, here also, I mean, there are trends, or people, when we read those articles which we get every month in Erstablatt, there's a magazine that doctors receive every month. There are two magazines basically. One is from the state and one is from the country, like the Central Medical Council, and one is from the State Medical Council. So every doctor receives two magazines per month, and then there are articles relating to medicine. And then there are articles relating to politics, so medicinish politics, so medical politics, about the doctors, the healthcare system, about the doctor deficit of people, about new technologies coming up. So there are many things in those magazines, and in those magazines very often, and those magazines are like mouthpiece of the medical councils. It's not private enterprise. It's not private opinion from people. That is mouthpiece of the medical council. So those magazines are take it with some authenticity, that those, when they write something, then they are like similar to government, so they are accepting something and acknowledging something. So there in those magazines, in those articles, there are often articles about aggression, rising aggression against doctors in Germany as well. But when we compare the situation that in India, doctors get beaten up very often, I mean, nobody cares. Doctors are soft target. The police oppresses the doctors. The politicians do that. Common people, as it is, do that all the time. The hospital management tries to oppress those doctors. So every doctor is a soft target for everybody. Because even with education and even with everything, because we do not have that power to punish, like suppose in India we have civil services exams, IAS, IPS and all. So those people have the power to punish. Doctor, even the highest doctor, does not have any power to punish. He is a healer. He can give his opinion, can do his operation, but he cannot punish anybody. That is why, and one who cannot punish does not have respect in our society. That is the sad state of our society. So in Germany, how it is like the trend which I was talking about, that trend is rising. When we talk to other people who are like 20 years, 30 years in the profession and now senior, so they talk about the respect they used to have when they began their career, and the situation which is now. It also in their opinion, it is declining. The respect for doctors has dwindled down thanks to the modernization and the economization of medicine. Even in Germany, the pharma industries over here, the medical products industries there. So somehow the opinion is influenced. The doctor's decision is influenced from the hospital management, that this particular, suppose there is a knee arthroscopy. So knee arthroscopy, meniscus repair, why is the patient admitted? It's like ideally one has to admit the patient and say, not admit the patient, operate the patient and release the patient same day. You don't have to admit the patient of station in the ward, because then that costs, and so the hospital management will press you on that you release the patient, but you are the doctor, and the patient, when he says that no, I have pain and I have this and I cannot, I'm alone at home, there's nobody to take care of me, then you tend to take the patient in the ward. So then there is a conflict that hospital is management, but you are working for the hospital, they are paying you salary. So then you are answerable to them. In that case, when you are the person who are sharing the agenda of the hospital to the patient, then the patient might be not happy with you, that okay, what nonsense is this. That is one scenario, that is a very commonly seen, that is our everyday work, is one thing. But the proper aggression that we are talking about, that the relatives get aggressive with the doctor, that happens in the note-of-nama. Note-of-nama is the emergency department. The major reason for that is a long waiting period. In Germany, there are not so many hospitals as in India. In India, like we have every few kilometers. I'm not talking about the total rural area where there is no hospital at all, but I'm talking about a city or a small town. Even in towns, you have hospitals, you have clinics at frequent, in comparison to Germany. Here in Germany, in one city, in a small city, I'm talking about, let's say 30,000, 40,000 population, you will have one hospital. I mean, that one hospital will have a lot of capacity. They will be doing heart catheters or cardiac catheter lab, they will be there, endoprosthetic lab will be there. So there will be many things over there. It's not like a district hospital where in India where there's no facility at all, that they cannot do endoprosthetic, they cannot do the cath lab thing. So emergency, so these things are the emergency operations. So those things can be done at smaller hospitals here. But the note-of-nama, because that hospital is responsible for so many people, the 30,000 is the population of that city, but the neighboring cities, the smaller cities, the villages, they also drain the people from that. These places also come to the same hospital. Then there is a huge waiting list. Like people wait in the emergency for 4 hours, 5 hours, 6 hours. So that because there is one doctor, suppose in surgery, when I'm working in the hospital in emergency, I'm one surgical resident who has to see all the patients, all surgical patients one after another. That means, and other part is what is contributing to this is people who are working in kitchen, suppose, and they with kitchen knife, they got a small cut on the finger. Those also come to, I mean, in India, people would put bandage across that and it's finished, nothing more to be done. But here, because they have paid insurance, they have the feeling that we have a right to the medical healthcare system here. And then they come to the emergency department, and people with such thing, like you are walking and you just stumbled your toe across some stone or something, and you have pain in your foot. In India, nobody goes to the doctor for that kind of pain. Or if your foot is somehow little bit sprained, you don't go to the hospital. You say that okay, 2-3 days, some iodex or something, and then it will be fine. And most of the time, it is so. So, but here, because they have paid insurance, they have that feeling that they have right to the best medical treatment. The doctor has to look at it, has to examine it, has to do X-ray, has to properly give him medicines, and then write him Krankschreibung. Krankschreibung is your medical leave. He has to give him 2-3 days medical leave so that he can sit at home and relax because of his leg pain. So, and he will not be, the money will not be deducted. He will get his salary from the employer. So, because of these things, they come to the hospital. And then they crowd the note-of-nama, the emergency department. And when after 4-5 hours of wait, you see that patient, you have been working all the time. You're not taken any breaks, you have not gone anywhere, you have been doing one patient after another. Then you have such patient who have waited for 4-5 hours, and now he is aggressive. Because according to him, he has a right to be treated first, because he has paid insurance all his life. Now that is a contradiction. There you have to be very tactful and explain to him how this is an emergency department. And in emergency department, what is an emergency? You have to explain to him that, okay, people who have a polytrauma, who are going to die in 1 hour or 2 hours, those are your priorities and not this foot. But in this situation, while you are explaining this, the thing can go wrong. You can explain in such a way that he will get offended. And then you will have a complaint. Either he will have verbal abuse against you, or you will have a complaint with your superiors the next day. So this is a very common, this is a very typical situation about, and also on the in the wards, if you have some old lady and the relative comes to visit and they see that okay, they have not gotten their food, they have not gotten their some medicines are mixed up. Obviously, it's not always your fault. The nurses who are doing that, they are also overworked. Sometimes there is a lapse, there is a genuine lapse of treatment. But you are the doctor, you are a responsible person, so you will be caught hold of that, okay doctor, what is going on. And so the point here is that so these situations are typical aggression situations, but the situation is not as bad as they don't start hitting off a doctor, because that is a crime. They will be you can, the slightest intimation, you can call the police and they will be arrested. And so that's why not because you're a doctor, just because any civilian has a right to, if you are threatened, you can call the police and police will be immediately there to protect you. So people are scared. The legal system here is not so easy like in India. Like in India, if a doctor is beaten up, doctor goes to the police station, then the police does not do anything. That has been shown in many cases in last couple of years, which we have seen that, okay, doctor was beaten up, went to the police was saying, yeah, manage something, settle something, or they want something before they start acting. So these things do not happen here. That is why the people, before taking any such stand, any such aggressive stand, they also think that okay, this is going to end up bad for them, and they do not do that most of the times. Here you will see a clear difference while working in emergency department. Since I have working here more than 3 years now, you will see a clear difference between people who are original Germans and people with migration background. People who are like original Germans, they will when they are very irritated, first of all, they understand the situation, that it is going slowly worse. They are glad that, okay, there is somebody who is taking care of them most of the times. But then there are people in their 30s who think that they're entitled for everything since they have been paying taxes and everything. So they are entitled, they say that, okay, they deserve something and it has to be given to them. Yeah, there are people like that. They do not accept the reality of the situation. That there is a doctor shortage. There is only one doctor who is going to check all the patients for entire 24 hours, one after another, and in between, apart from the finger cut and the leg sprain, he might get really trauma patients who has say spleen rupture or say rib fracture or pneumothorax. So where he has to spend more than like half an hour. We have to put chest tube or do intubate or like whatever things are to be done. So those things are real trauma, real emergencies, and those has to be managed first. But everybody who is sitting in the waiting area does not see what is actually going on. They feel that doctors are just sitting with their hands crossed and playing cards on internet or something like that. So there you have to be very tactful. I was telling you about the difference between the Germans and the non-Germans. Germans, even when they are pissed, they will not be so aggressive with you. They will have a tone that you will realize that, okay, this person is pissed. Now I have to be careful with him while talking. Otherwise, I'm going to have a complaint against me the next morning. So that is, from physical threat, you should not assume they are not usually not physically abusive. The people who are drunk are in inebriated state. Those are that we cannot include in this discussion because they are not in the right senses. So that you can exclude. They are aggressive as it is. So that is the one case. The people with migration background who come from other countries, like say first generation migrants who directly come here, they are somehow okay. But the second generation migrants, those whose fathers or forefathers came here, or the third generations, they have that, they have raised, I'm not being judgmental here, but that is what I feel, and they have been raised in such a way that they believe that only with aggression they can achieve something here. If they're not aggressive, if they do not snatch something, nobody will give it to them. That is maybe that is their experience all the while, or that is what they have been brought up to, or that is what their experience, that is what that's just assume. And then when they come with this feeling to the hospital, they have that feeling that, okay, if they're not aggressive, then they will not be treated properly, or the relatives will not be treated. There you have to be careful that those people can get physically abusive, because they are not afraid of the system, because they are like, they have the mentality of different countries. I mean, I will not name those countries, but the neighboring countries which has poured immigrants since last 4-5 decades after the World War II. Those people have that, they are aggressive, they live in their own communities, own clans you may call it, and they are not afraid of the police, or they are not afraid of and they have not accepted the German way of life basically. So when you deal with those people, and there also there is there is a misunderstanding, very high chance of misunderstandings, because when as a foreign doctor you are there, then they treat, Germans do not treat you as like a foreigner. Okay, that is very interesting. When you are there and you speak, they are actually glad that you are there and you are taking care of them and everything. But people who are with migration background, they think that you are not as good as any German doctor or any white doctor. So there you can feel that. You can feel that difference in the communication, what they and what they expect. They think that they can like put you down, they can press you for doing something or doing certain things. So there you have to be very clear that, okay, no, that is not the way. And important thing is that you have to keep your tone, a proper tone. You don't have to be abusive, you don't have to be aggressive. And if you keep a proper tone, then, and since I told you the law functions very nicely in Germany, so there you have law by your side. And you can do your work properly. So people who are planning to work in Germany in future should not be, I mean, the obviously tendency is rising, and that is overall, that is not only in India, it is in UK, US, all the countries, wherever you can name it, because there is a stress on the healthcare system. Doctors are less, patients are much more. Patients are reading nowadays, looking on internet, they are they know, the educated people, when they come to you, they already have the diagnosis in mind, and they just want, because Google does not write prescriptions, so they want to come to you for prescriptions, and they expect you to follow the regimen Google has offered. Most of the times, I mean, sometimes you agree to that, sometimes you don't agree to that. And when you don't agree to that, then you will have a conflict. Then you will have to explain the patient. There the explanation part becomes very important, that you have to explain the patient why. And then you have to, if you find that, okay, the patient is not going to understand, then you have to kindly, like very gently refuse the patient, that he might look for any other doctor, he might go to some other doctor or some other hospital. You are not bounded to treat him, or if she's not, or he's not looking, I mean, seeking your advice. So this is what I was telling you, people who want to come to Germany for future studies, or I mean PG training, or work in Germany after that. So you don't have to worry about physical abuse as such. I personally have not, I mean, last 3 years I have not experienced any physical threat as such. I mean, obviously some people are nice to you, some people are not nice to you, and that is same way. You are nice to some people and you are not nice to some people. You just say like, I don't care, go to hell. You don't say that, you have it in your mind, and you just write something on paper and you give it to them. So that's reciprocated. That is not a problem. We are coming from India, we are used to that. So yeah, you don't have to worry about physical abuse or threats, something things like that. Yeah, obviously you're working with in bigger cities, where you have a lot of intoxicated people there. The threat is always there. So you have, when you're working as note arts, that I'll cover a topic. I'll make a topic on what is a note arts. When you're working as note arts, you're working on the street in somebody else's house. You're going as a doctor there. We are going in a community where there are 15 people, 15 families coming from, say, Albania or Turkey, and there somebody has, say, knife attack, and they have called ambulance, and you are there. And then you enter that, there you have to be really cautious, that because there are then 15 families standing near you, and there is a patient who is trying to, like, you are trying to resuscitate, and then something goes wrong there, what will you do? That you have to, that is a very different concept, the different topic that is not in everyday life. That's only for doctors who choose to become note arts, choose to become those medical doctors who go with ambulance on the street to somebody, like outside clinic setting. So yeah, with this I end this video. I request you guys once again to like this video if you find this information useful somehow. Subscribe to the channel, and press that bell icon. I did not know so far what is the bell icon. I used to watch videos. I don't watch YouTube videos so often, so I did not know what is the bell icon. Recently I've come to know that there is a bell icon. When you click on that, then whatever videos I make in the future, you will get a notification for that. So I find that pretty good. Then you guys can do that. Thank you very much. Have a nice day. Bye bye.